and welcome everybody for joining us today. I'm so excited that folks in the middle of their day were able to come and participate in this really important session. For those of you who are wondering, we will be videotaping this. We are videotaping this, so this will be available to all of our employees at Henry Ford Health System, and then we'll also be making it available in the near future on our Henry Ford Health System YouTube site so that your friends and families can also view this important session. My name is Betty Chu. I am the Senior Vice President, Associate Chief Clinical Officer, and Chief Quality Officer for Henry Ford Health System. If you could do me a favor and check real quick to see if you're on mute, it would really help us out. And I may occasionally remind folks to mute themselves. I know it's hard when we're getting this many folks that are coming in, but again, would really love to be able to have everybody be able to hear the speakers. I'm really excited today to invite and introduce Dr. Richard Leach and Dr. Monique Swain, who are colleagues of mine and really knowledgeable, wonderful members of the department. I'll tell you a little bit more about them in a minute to share with us their wisdom and guidance related to this important topic. I just wanted to pause for a minute and share with you why this is such an important topic for all of us. Certainly, we've heard a lot about the need for vaccination, but this topic in particular, fertility, pregnancy, and the COVID-19 vaccines, is one that sparked a lot of interest in the general public. It sparked certainly a lot of interest from our employees. We've clearly heard the message from our own employees that one of the reasons they're hesitant to get the vaccine is their concerns, especially those reproductive age women, around their own fertility and around pregnancy. And so we really want to shatter hopefully some of those myths for you and really share the most pertinent and relevant information from our own Henry Ford Health System experts today. So with that, let me just jump right into the introductions. On the WebEx call, you should be able to see, you can see his name, Dr. Richard Leach. He is one of the benefits of our affiliation with Michigan State University. He's recently joined us as the chair of Women's Health Services for the Henry Ford Medical Group and for the system. He is a board certified in obstetrics and gynecology, but also has a subspecialty certification in reproductive endocrinology and infertility. Thanks so much, Rick, for joining us today.
Thank you,
Thanks, Rick. We also have Dr. Monique Swain. Dr. Swain is a Henry Ford OBGYN. She specializes in breast cancer treatment, but she also provides fertility preservation counseling for younger breast cancer patients, cares for pregnant patients, and delivers women who are pregnant. So we're super excited today to have these two experts join us. So thanks so much, Monique and Rick, for joining us today.
Thank you.
All right. Again, I'm going to just remind folks to please mute. And please feel free to put questions in the chat box. We're going to spend probably the first 20 minutes or so hearing from our experts with a few key questions. And then we're really hopeful that we'll engage with you in the chat box around your questions so that we can make sure that we answer any things that you're concerned about. Also, if we don't get to all of your questions, we're really going to make sure to answer those questions and post them online for you as well. So please put all of your questions in the chat box and we'll make sure to get to those as well. Okay, so the first question, and it's probably on everybody's mind right now, but should pregnant women receive the vaccine? And that question I'm going to direct to Dr. Swain.
Thank you, Dr. Chu. So quickly, the answer is yes. The providers here in the Women's Health Department at Henry Ford, as well as ACOG, which is the American College of Obstetricians and Gynecologists, and the Society of Maternal Fetal Medicine, encourage women who are pregnant to get the COVID vaccine. Our reason is because we know that without protection, the disease, unfortunately, for these women are more severe. Particularly, we find women of color are more likely to, unfortunately, experience more severe symptoms. They're hospitalized at a rate 4.7 times more than their counterparts, and they're more likely to die 1.4% higher than their counterparts. Sad to say, unfortunately, here at Henry Ford, we've had the experience of having 2 maternal deaths, and both were women of color. Also, to add, there are some protective measures that we have noted too and breast milk, that the anti-COVID antibody can be found in breast milk, which could be protective for the infant as well. So I think it's just really important when weighing the pros and cons and talking to our patients that these are something that we should counsel them and advise them on.
Monique, I'm going to just go back to that one part of the statement that you said, that we had a few really unfortunate cases of pregnant women that had COVID. And I know that's something we're seeing around the country with women that have had COVID who are pregnant and their outcomes. So I was just wondering if you could comment a little bit more about, again, your experience and your thoughts on pregnant women with COVID and the risks to women getting COVID when they're pregnant.
So in terms of women when they're pregnant, unfortunately, the severity of the disease is far greater than any adverse effect that they may experience with the vaccine. There was a study, which some of you may have already read in the New England Journal of Medicine, that came out a few days ago, looking at adverse effects of the COVID vaccine and showing that they were no worse than if a woman was non-pregnant. When you compare that to the actual risk of getting COVID and the, unfortunately, the morbidity that can cause, it truly, unfortunately, outweighs not getting the vaccine. So for us here at Henry Ford, we are recommending that our pregnant patients get the vaccine for that reason.
Thanks so much, Dr. Swain. I'm going to ask the next question, and it's a general and important question. I think I'm going to ask both the panelists this question. I'll start with actually Dr. Leach, and the question is the vaccine safe? You've alluded to a little bit, Dr. Swain, but maybe you could expound upon it more, Rick.
Thank you, Dr. Chu. Yes, it is safe. And, you know, the uncertainty that I think patients and our citizens had regarding the vaccine was really the name of the rollout of the program called Warp Speed. And I think there was this uncertainty that the care and carefulness that was used in the development of the vaccine that we've used in the past was not taken. But in reality, this new mRNA technology is anywhere from 10 to 12 years old. This was developed around the H1N1 pandemic that happened almost 10 years ago, and it was used in preparation for the next pandemic. So this was something that's been developed, been studied, and it was this new opportunity to use this technology for COVID. The other, I think, really important point for all of us to understand is that the vaccine had to go through the same FDA trial and approval that any other medication or treatment goes through. So the safety trials, the efficacy trials were equally and exquisitely taken care of in terms of the details. Unfortunately, because of the newness of this approach, and I think just because the overall effect that the pandemic had on all of us and our families, was that there was a lot of social media and internet misinformation. And that misinformation, I think, has led to a lot of this uncertainty and wondering if this is in fact safe. As Dr. Swain has alluded, every authoritative body in women's health has in fact validated and is in fact going over all the information that is coming out on a daily basis. And the recommendation from all of them is for women who are planning on getting pregnant and those women who are pregnant to take the vaccine. So it is safe. It's I've taken the vaccine. My children, adult children, are all taking the vaccine for those reasons.
I think that's so important. I've had the vaccine as well, and I think one of our very first Henry Ford employees was a pregnant woman in her third trimester that took the vaccine, and of course she's had her baby since then, a beautiful baby since then. And Monique, anything, Dr. Swain, that you'd like to add to some of the concerns and the things that you're hearing that patients are concerned about in regards to safety?
Yes, I mean, in terms of vaccines, and we're all familiar that women have been receiving vaccines for decades, over 30 years. Specifically, we offer the flu shot to women each year during flu season, as well as Tdap, which is extremely important to protect the infant against pertussis, which is whooping cough, and also advocated for by our pediatricians. So we've been dealing with vaccines and pregnancy for a long time now. And I just want to assure our patients that as providers here at Henry Ford, we do our best to do our homework and do our research before providing any recommendations to you.
Thanks for that. So the next question I'm going to point towards Dr. Leach, given his years of expertise with infertility. Talk to us more about this concern women have around infertility. Does the vaccine cause infertility?
It does not. And it is a common question that we're getting from our patients and from most women who are in fact very concerned. This is a very important part of their health is their fertility. And here's what we know today. We know that the effect of a COVID infection, so if you come down with COVID, there is some evidence now coming out that in fact a COVID infection and its after effects may in fact have impact on early fertility and miscarriages. And so this is still needing to be studied. We do know that viral infections can affect fertility short term in other cases. And here's what we know about the COVID vaccine on infertility. Through the really sophisticated FDA approval process, the vaccines did not cause infertility in laboratory animals. The COVID infection or clinical trials of those women who were in fact vaccinated, we know that some of those women did in fact become infected. And now through this very large FDA after clinical trial number 4, looking at efficacy, looking at the millions of women who have now undergone vaccination, there's no report or any concern with infertility. So we are gaining more and more knowledge, and it is really, again, recommended by all the authorities, myself included, that women receive the vaccine not to be concerned about its effect on their future fertility.
Thanks so much for that. And as I'm reading the questions in the chat box, and there's wonderful, wonderful amounts of questions in the chat box that we're going to get to, a lot of them really speak to your opening statement, which is you're hearing a lot. And I know as well as I am in my office seeing patients and Dr. Swain about concerns about fertility and about concerns about getting it during pregnancy. You had mentioned that, your family members have gotten it, and I think some of the questions in the chat box are related to long-term effects. While it's true that there's been no untoward effects that we know in women who've gotten pregnant from the vaccine, following the vaccine, what are your thoughts, from a scientific perspective around what we'll know about long-term effects and maybe infant outcomes related to the vaccine?
Well, Dr. Swain alluded to our experience already. This vaccine, the ultimate endpoint is for the individual who is vaccinated to produce antibodies to fight off the virus. And so all of our vaccines that we've used for the last 30 years, in fact, that's what they are doing. And that's what this vaccine does. It just does it a little differently. And so in terms of the long-term untoward effects, there's no biological reason to suspect that this will be any different. And again, I think looking at social media and the internet is very helpful for us. But many times there can be misinformation. And some of the points that have come out regarding the vaccine with infertility is that, there is a protein that is required for implantation in normal pregnancy, and there's some cross-reactivity with that protein in the vaccine. that is not true. It was sheer speculation early on when the vaccine was being developed, and now that has been debunked. So we have to be very careful about where we get our information, and I can only really encourage and echo what you have said, Dr. Chu, and that is, the employees, our staff, our family really need to go to 1 Henry. That's where I think the up-to-date current information is. And it's information that is really looked at on a daily basis by our experts at Henry Ford to give the best advice to our employees and families here at Henry Ford.
Thank you, Dr. Leach. So Dr. Swain, I'll ask this question. I'm going to go right into the chat questions because there have been so many great questions, and then I've got a couple more of my own if we get through those. So we're hearing a general theme. One of the common themes we're hearing in the questions are essentially boiling it down. Is it safe to get the vaccine in the first, second, and or third trimester? So, we get that question a lot as obstetricians, right? When's the best timing for things, whatever it is. Monique, do you have any thoughts, Dr. Swain, around timing and if there's anything you advise patients regarding timing of the vaccine?
Yes, so I alluded to an article that just came out in New England Journal of Medicine, which looked at 35,000, or actually over 35,000 women who were pregnant or becoming pregnant. And there didn't seem to be any difference in terms, like I said, in terms of adverse effects, and that includes miscarriage rates as well, whether the woman received it in the first, second, or third trimester. So based on that data, this preliminary data, it's safe and any trimester to receive it. I would always say not to delay because it's worse to actually get COVID that had the side effects, whether it's fatigue or chest pain or body aches from the vaccine itself. As I mentioned, being in it and being on the ground and being a provider for these patients and seeing the suffrage that I have for some of the women who have unfortunately gone through the devastating effects of COVID, I don't want to see that. I know that our women don't deserve that here and they deserve better. And if we have something here to offer them to protect them, I think it's definitely, as our providers, first do no harm and to make sure that they're safe. So far the preliminary data says that it's okay, regardless of trimester.
Yeah, and I think too, I would add on to that, I think one of the questions that I'm hearing in the chat box specifically related to that article is like many articles that we publish scientifically, there's always that sort of end statement which says, we still need more information and still need to study it further. And that's really true for every scientific article that we see online, which is there's often that kind of phrase in there that says more longitudinal studies are still needed. I completely agree with you in terms of what we're the most concerned about today is that our reproductive age women don't get COVID, and they certainly don't get COVID when they're pregnant. Because that, I think, is the biggest thing that we're all worried about, and we're seeing really bad outcomes related to those women who are pregnant that have gotten COVID based on the severity of the disease. And I think we can all appreciate that COVID is going to be around circulating the globe for, unfortunately, quite some time. And so we definitely need to protect ourselves. So I really appreciate the thoughtfulness of those comments, Dr. Swain. Maybe Rick, this next question I'm going to direct to you. In the chat box, we've got, is there a difference between the vaccinations, Pfizer, Moderna, and J&J for pregnant mothers? So in your thoughts, what are your thoughts on that?
There's no difference. So the recommendation to receive those vaccines is to protect you from infection, right? And so as far as the Moderna and the Pfizer, those were the mRNA platforms. Certainly there's been this recent question regarding the thrombotic episodes with the J&J. That they looked at. They pulled the vaccine for about a 10-day review. The FDA looked at that data, and their decision was that to proceed with the vaccine, and they now are redistributing it around the country.
Thanks. And this is, I think, a slight varying on some of the questions that you've been answering already, but I'll just point it again at you, Dr. Leach, because I think, it seems to be something that's really top of mind for people. How can I feel comfortable getting pregnant if there are no long-term outcomes on this vaccine? So I think it's, again, that question of, the vaccine hasn't been around for long if we haven't studied it long-term. So maybe it speaks more to the science that you were talking about before around vaccines in general.
Yeah, and again, the vaccine that is currently, at least the two major ones, the Pfizer and the Moderna, again, the end result of that vaccine is to generate an immune response in the patient, in the woman. And so the RNA that people are concerned about actually is destroyed probably within minutes if it is not incorporated into the cell. That's probably more detail than we need to talk about today, and we can go into more at a later time for those who are interested. But in the end, it is the same mechanism. We are using the same approach in terms of vaccine development as we've used 30 years ago. And we're using those same approaches now as Dr. Swain has talked about. We're using those routinely, recommend those routinely. And this concern that has been placed on the internet due to the uncertainties of some of the things that have been said, I think hopefully you will believe and hear our confidence that there is quite a bit of safety evidence in terms of the long-term impact in fertility. There's not even biological plausibility for that.
Dr. Chu, you're muted.
Thank you. The question that was in the chat box was very similar to what you just answered, which is, I have a 16-year-old and 19-year-old daughter. Should they be concerned about long-term fertility? So I appreciate you mentioning that as well. One question was, can you make the scientific journal articles on the topic available along with the presentation? I'm sure we could, and so we'll make sure to consider that as follow-up. I'm, again, really excited about the robust questions that we're getting in the chat box. Clearly, we've touched on an important topic for folks out there, so we really appreciate it. Here's a question. I'm going to direct this to Dr. Swain. If your baby might have a birth defect, should you still think about getting the vaccine? Thoughts on that one?
That's a great question. So short answer is yes. An infant that has a birth defect is not a contraindication to receiving a vaccine of any sort. So same thing with the flu vaccine or the Tdap. You still want to do your best effort to protect yourself. As an OBGYN, we protect mom in order to protect baby. Without the protection of mom, there can be no baby. So remember that when you're carrying this child, whatever we do to benefit you is also going to benefit the child. So a birth defect would not be a contraindication for that.
It's a great way to put the question. Thank you. And this one I'm going to give to Dr. Leach. What if a woman had COVID during early pregnancy? Wouldn't it be more effective to pass along natural antibodies?
Well, you certainly will pass along natural antibodies, but again, as I think Dr. Swain really clearly delineated, if you are infected when you're pregnant without the vaccine, you're at severe risk of the complications of COVID that are in fact much higher in pregnant women. The complications are more serious. And especially in our women of color, the issue of COVID infection during pregnancy is astronomical. And I think Dr. Swain will be talking about that here in a little bit.
Great. Thank you. For a few folks in the chat box that are privately sending me messages, if you could put them to everybody, that would be great, because then the woman who's helping with the chat questions could grab onto your questions as well, too. We're seeing a lot of those in the chat box. So, and along that same line, for Dr. Swain, can the vaccine cause a birth defect in an unborn child?
So according to the data we have now, the preliminary results, no, we have not seen any birth effects as a result of the COVID vaccine.
Since I have you off mute for a second there, you know, one of the things I wanted to ask you about as well, because I know you and I have talked about this with Dr. Leach, is, you know, we've noticed an even lower rate in the population of vaccination amongst our African-American employees and also the population, despite having the same access to the vaccine. At least now, there's certainly a lot of vaccine that's available. What do you attribute the lower rate to?
So Dr. Chu, this is one of those things that is extremely important to me as a woman of color myself. You know, growing up, I was very much aware of the experimentation that was performed on individuals of color as well as slaves, governmental laws that impacted women of color and their fertility, forcing women to essentially have tubal ligations without their consent or knowledge, and as well as the Tuskegee experiment, in which men were denied treatment that they knew was available to them that could help them with the disease of syphilis. So I'm readily aware of this, and I understand the distrust in the medical system because of what has been done to a lot of the community here. And looking at this, is this a governmental ploy against us? So I understand from that standpoint, and that's why I know for me personally, whenever some recommendation comes out, whether it's a new guideline, I find it extremely important for me to read the data, the research. Is it applicable to everyone? Is it generalizable? Is this something that I should be and can offer to my patients? So I just want to reassure those that look like me. I understand your hesitation, and I was hesitant initially too in receiving the vaccine, and I was not first in line, I will admit. Because I need to do my homework first, and that's just the way I've always been as a child. I always am going to ask questions. Why is the sky blue? Why is the grass green? So I understand your hesitations and reservations, and it's okay to ask questions. It's not offensive. You should ask questions. You have to be your own advocate, and I just want to let you know that we're here to advocate for you as well.
That's awesome. Thank you so much for sharing your personal thoughts and your experience as well as an expert. I'm going to go back to just a couple questions more in the chat box here. Again, they keep coming, so we may go over the half an hour, but again, we're taping this, and so for those of you who have to drop off. One of the questions, Rick, for you, has there been any studies or information released regarding male fertility and the vaccine? What are your thoughts on that question?
Not so much the vaccine itself, but certainly there is some evidence coming out now that COVID infection may in fact have an effect on sperm numbers and function. A recent article in the last 2 weeks has shown there's some effect, but we have to look at that article with with some critical thinking, and but there is a suggestion that COVID infection may in fact affect sperm and semen parameters. And so again, I think that's even another argument for why all people should, middle-aged, even if you're healthy, don't wait to find out that you can wait this out until it gets better. That if you get infected with COVID, there is some evidence that there is a semen or sperm impact.
Thank you. Thank you for that. You know, I'm seeing a few more questions related to, again, concerns about mRNA impact on the pregnancy. And I'm just wondering, you know, again, Dr. Leach, because I know this is of real interest to folks, and I'll read the question. I may have misheard, but I thought that there's information that having COVID can affect pregnancy. That's what we had talked about in terms of the higher mortality in pregnant women that get COVID. So perhaps you could restate some of the data around that. That's relatively recent. And then also in that same question, it says, aren't we more concerned that the COVID mRNA could affect the pregnancy versus the fact that you get COVID during pregnancy? So I think the question is, isn't it scarier to get the vaccine than it is to get COVID when you're pregnant? That's how I'm reading the question.
And it's a great question. And I think, you know, with the increasing knowledge of these various approaches, I think raises more questions. So the actual mRNA that is actually injected in the vaccine is actually uh, so minute, and once it is injected into the arm, it is then absorbed by those cells, all right? And those cells are what then is producing those spike proteins that you hear about that your body then responds to for the immune response. The mRNA then that is part of that actually is probably digested or gone literally within minutes. So that would not cross the placenta to the fetus. Remember that the vaccines that are not this new model, they're either what we call dead virus, so the dead viral particles. Those are injected ordinarily, as Dr. Swain described. And again, those no longer are viable or can cross the placenta once they're injected. So it's a good question.
Thanks. And I wonder too, Dr. Swain, because you had mentioned that we unfortunately have had, a few circumstances of really sick pregnant patients who've had COVID. Can you talk maybe about what's unique about pregnancy and, the situation of COVID, which is primarily affects the respiratory system, as we know, and perhaps some of the reasons why it could be worse in a pregnant patient to have COVID than, let's say, in a normal, healthy 22-year-old, 28-year-old who's not pregnant? What are the differences in those two patients when it comes to getting a COVID infection?
Thank you, Dr. Chu. So generally when a woman becomes pregnant, the heart is working harder. So there's an increased amount of fluid overload, is what we call it, in order to deliver nutrients and blood to the baby to support life. So when we have more a load on the heart and then you become sick, that can further produce, particularly with COVID, which we know impacts our respiratory system, can cause pneumonia, pulmonary edema, and heaven forbid, ARDS. That these things are further confounded, I should say, by pregnancy because of the amount of work we're already doing to support a fetus. So on top of that, now you are asking the woman not only to support her fetus, but to support herself in the instance of being sick. And that's much harder to do in a pregnant state. So for these women, like I've mentioned, it's just really important for them if we could eliminate COVID, from these women, and the best way we can is trying to prevent it. So that's important for our patients to understand the different physiologic changes that go on with our body and how there's more fluid when we're pregnant than not.
And really, it's exactly the reason we recommend the flu shot in pregnancy, because a flu in pregnancy in a pregnant patient is so much more difficult for those pregnant women, and it can also lead to mortality as well too. So, and COVID, as we know, is much more contagious, much more highly contagious than the flu is. So I appreciate you describing that. So I'm going to just take a couple more questions, again, knowing that we have quite a few in the chat box, but we will make sure to capture those questions and work to answer them for you, and then also post them on One Henry along with a video of this webinar. So again, for those of you who weren't on at the beginning, I made mention that we are videotaping this and we'll be posting it also for availability. Couple questions that we have here are related really to gynecologic related issues. I'm going to direct this to the first one to Dr. Leach. Can the vaccine cause blood clots or miscarriage? And I'll just add up to that one. I've heard the vaccine is affecting women's periods and ovulation. This is a concern for me. Why is this happening?
Yeah, that's a good question. I think there is two questions there. So first is the miscarriage. We're not talking about the vaccine now. I've not seen any evidence to suggest that there's an increase in miscarriage or increasing alteration of the menstrual cycle. As I said earlier, there is some reporting going on now in the UK that women who have COVID infection may in fact have a higher rate of loss, so in the first trimester. Again, it's an observation, it needs to be studied, but those reports are coming out of England. In terms of menstrual irregularity, again, I know that there are multiple observational studies going on around the country. I believe Henry Ford may be doing one of these, actually looking at these characteristics. Is there an effect on menstrual flow? Is there an increase in this irregularity and increase of early loss? But I think the data is still out in terms of the infection and in terms of the effect of the vaccine on those two events. There's no evidence, at least reported to date.
You know, and I'm getting a couple more questions. I think I'll kind of end on this a little bit, but related to that, again, there's a lot of interest, and I'm excited to see people are reading the New England Journal of Medicine article, getting a lot of folks that are quoting that. And I'm wondering, you know, Rick, because I know that you've been an academic researcher for a long time, and maybe speak a little bit about that article shares observations of a cohort of patients. It's not a randomized controlled retrospective study where you take a bunch of people who got something and a bunch of people who didn't get something and you're comparing. So one of the comments in the chat box is, among 221 pregnancy-related adverse events, the most frequently reported event was spontaneous abortion. How can this be considered safe? And in the context of that type of a study, could you maybe explain how to interpret that data, how to interpret that kind of information when you're looking at adverse event reporting versus a randomized controlled study?
Yeah, so that report, and I presume we're talking about the same study,
Yes.
but the miscarriage rate, spontaneous abortion rate was 18%. They did not have a randomized, this is not a controlled study, this is an observational study, you know, Dr. Chu, as you had commented on. So that matching one group versus another group, this is observational, looking at all comers. And so this 18% miscarriage rate is actually right at the natural miscarriage rate that women have ordinarily. So at least if you're comparing that to what we know in general, there's no increased miscarriage rate. And again, these ongoing studies I alluded to before are occurring now, so that we can actually have a controlled study where we can compare both women groups together. So if there is a difference, we're going to be able to see a difference research-wise.
Dr. Leach and Dr. Do you mind if I add
Please.
just for a second?
Please
So
do.
I just want to explain in terms of research when it comes to understanding statistic and numbers, because you can spin things any way you want, generally speaking. But I'm going to give an example I think that will kind of help resonate. It has nothing to do with medicine. But in general, we know that approximately 1 in 3 men of color are going to go to prison, right? 1 in 3. So that's 33%. And then if you look at how much they actually represent African Americans as a whole, or a color whole, is 13%. So if you compare those numbers, that's how you can make the decision. Is this ethical or not? Is this the same? Is there an increased risk or not? And as you can see, comparing those numbers, that's an increased risk, because in general, all people of color only represent about 13%, yet 33% of African American males are going to prison. Now, if you look at miscarriage rate, we go back to medicine, 10 to 20% of all pregnancies will end in a miscarriage in general. So if the number falls between there, then there means there's no increased risk. It'd be different if it came back saying, oh, there's a 30% of people are miscarrying who had the vaccine, or 40, then yes, that is a discrepancy. But as long as it falls in between what's the norm, that there is no increased risk. I hope that helps for some people, but that's how, when you're interpreting statistics and data, we have to compare to what's the norm, and is it outside of what the norm should be.
Yeah, I think the 2 points that you both bring up are so important, because we've had so much data this past year on COVID. Oh my gosh, we've all become expert statisticians with all the data online and trying to interpret the data and stuff. And the various type of studies that have come out, it's been very challenging, I think, for all of us, myself included, and the general public. As you mentioned, Monique, we're doing the same thing, I think, as physicians, really trying to interpret the data as best we can. But what we're hoping to provide for the general audience for this group, and hopefully you found today with this session, is we're trying to help be that conduit to interpret the information for you. So please feel free to reach out and ask those questions. That's what we're here for as your Henry Ford Health System experts. We've been so blessed to have Dr. Swain, Dr. Leach on the call today, and I really, really appreciate all the questions that people have posed, recognizing that there may be more interest in this, so we'll have to see. I see some calls for another session. We'll see what we can do, but if nothing else, we definitely will make sure to take those questions that you guys have posed and provide some feedback to you. So again, the real take-home message is we really care about your safety. We really care about all of us getting through this pandemic together in the best, safest way. And we're really hopeful that in order to do that, that we collectively can all get vaccinated. That really would mean a huge amount. I've got kids. I know many folks have kids on this call, and I would love for my kids to go back to full-time in-person school in the fall. And we're not going to be able to do that until we all get vaccinated. So again, I really want to thank everybody, thank the team that was able to set up this webinar for us. And again, thanks to Dr. Leach and Dr. Swain for their expertise today.
Thank you.
Thank you.
Thanks for inviting me.